So I'm on call at the hospital one day and I get asked to see this woman in the emergency room who came in with confusion and a high fever. When they did her initial blood test, her white blood cell count was quite high, so it was obvious that she had some type of infection. So they called an infectious disease consult. I go down there to the emergency room with my residents, the resident doctors in training, and we go to start this evaluation on this woman. We get to her bedside in the emergency room and she is confused. She looks to be as dry as a bone, so that's dehydration, and she really looks very sick. So we realize, okay, this woman is in bad shape. Her blood tests also showed that she had some early signs of kidney failure, probably because of the severe dehydration she had. So as a part of managing her, we decided to put a catheter, a tube in her bladder to be able to monitor her urine output and see how we're doing with treating her dehydration. We put the catheter into her bladder and lo and behold, we get frank pus. We get pure pus from her bladder. So there is the source of her fever and severe infection. She has a bad urinary tract infection. Of course, I'm talking about this patient because this person was diabetic. Her blood sugar was also sky high. So in today's video, we're talking about urinary tract in diabetics. And I got asked the question once, why do diabetics get UTIs so commonly, right, compared to people who are non-diabetic? UTI refers to urinary tract infection. So we're going to talk about UTIs in diabetics and what it is with diabetes that causes people to have more frequent urinary tract infections. We're going to talk about the causes of urinary tract infections. We're going to talk about symptoms, treatment, and a few no-nos that me, particularly as an infectious disease specialist, I don't like to see when it comes to urinary tract infections. All right. So causes of urinary tract infection, especially in diabetics. Well, obvious one is that there is too much sugar in the system. Your blood is sweet. And when the blood is sweet, it means that you have a lot of food that germs like, right? So high blood sugar, food for germs. If your sugar is high, the sweet urine coming out of your bladder is going to be in that genital area. And any germs on the outside of the genital area now have access to this food. They have access to food, they're fed, so they're going to multiply, they're going to grow, they're going to thrive. And if they get to a high enough concentration because they're fed so well, then it means that they can escape and go invading areas that they are not supposed to be. If these same germs get into your bladder because they've made it up into your bladder, there's sweet urine in the bladder, there's more food for these germs, and they will continue to multiply to the point where they can spread up to your kidneys, they can spread into your bloodstream, and they can cause you to have a very bad bout of sepsis from a very bad urinary tract infection. All right. Another thing about high sugar and the tendency towards urinary tract infections is that when the sugar is high, you tend to have yeast infections in the genital area as well. So you're already having an overgrowth of bacteria because of all that sweet urine that gets out there, but then you're also probably having an overgrowth of yeast. When there's an overgrowth of yeast, sometimes it can get to the point where the skin is irritated. So you might have itching, or it just might be non-specific irritation to the point where the skin can have microscopic breaks that these germs, the bacteria, can get through, and also microscopic breaks where the urinary tract is, where the urine is coming out, and the germs can get in there and start causing infection as well, right? So several reasons for just a higher chance of infection from having sweet blood or a sweet body in general. Another thing with high sugar levels in your body is that the high sugar makes the immune system lazy. The cells that give you a nice strong immune system so that you can fight germs, fight infection, they don't work anymore. And so germs can escape because the police that's supposed to keep them away, they're sleeping. All right. So another reason for urinary tract infections. And then another reason too, and this might be overlooked, is that high sugar eventually can cause damage to the nerves all over your body, but including nerves that supply your bladder and help to tell you, okay, my bladder is full, I need to empty out the urine in my bladder. If the nerves for your bladder are damaged, your bladder does not know, you don't get that stretch sensation and are able to go to the bathroom on time to empty your bladder, so that sweet urine stays in your bladder for longer than it really should. And that's stasis, and whenever you have stasis or stagnation, again, a recipe for overgrowth of germs. It's just like a swamp. A swamp is stagnant water, and you can always tell that there's an overgrowth of germs just from the smell. So if you have stagnant urine, you're not emptying out your bladder, then you're going to have an increased chance of urinary tract infections, right? Now, other than the sugar, being high in a diabetic, you can also be more prone as a diabetic to have urinary tract infections, because diabetics may be more prone to having stones in your urinary system, and it has to do with the type of diet that diabetics may be more prone to consuming, having sodas and so on, that promote the development of stones in the urinary tract. And whenever there's foreign material in the urinary tract, such as stones, these are areas for germs to cling on to. And sometimes you might have stones, the stone is infected, and you're never able to get rid of germs in your urinary system for as long as you have those stones there. Unless you pass out the stones, or you get a procedure to break up those stones and release and get them out of your body, then you have germs, bacteria leaking into your urine repeatedly from these stones. And so you're just prone to having recurring urinary tract infections. So a very serious issue. You can have stones in your kidneys, or you can have stones in the urinary bladder itself, harboring germs. And then the final cause related to your urinary system in general, not related to stones or to sugar, but, well, semi-related to sugar. Having sugar in your urine can make your urine less acidic. So your urine may be a little more alkaline. Now, having a more acidic urine means that urine is a more hostile environment for germs. So if your urine is so sweet and it's not as acidic, so you lost some of its acidity, it means that the germs can thrive even more, overgrow, and cause a bad infection. And actually, we exploit that. We take advantage of the fact that germs don't like an acidic environment by giving a medicine to cause more acid in the urine to decrease the chance of urinary tract infection. I'm probably ahead of myself. I should have waited to treatment to get to that. But anyway, those are some of the causes, some of the reasons why people with diabetes are more likely to have urinary tract infections. What are the symptoms of urinary tract infections? Well, it might be none, because if the nerves are damaged, then you might not actually feel the classic symptoms of urinary tract infection. And that may actually have happened to our patient that I described first at the beginning, who ended up in ICU. She did not notice the symptoms. And with diabetes, sometimes things can get bad really rapidly within a space of hours, and you're good, and then you're in ICU. All right. So the classic symptoms, though, would be burning when you urinate. So the urine is coming out, and because the passages are so inflamed, the burning, the urine, the acid in the urine, the urea, all that burns the tract while it comes out. It's very painful. And if there's that much inflammation in the urinary system, you can actually have a little blood with the urine as well, because those irritated areas are bleeding a little bit. Sometimes the blood you see might just be at the end of the urine stream. Maybe when you wipe, if you're a woman, you might see a little drop of blood on the toilet paper. It's because of all the inflammation. It's very painful. Also, your blood is so irritated that you get that sensation to urinate every few minutes, maybe every hour, but sometimes every few minutes you just get a tendency, an urge to urinate, but only a little bit of urine comes out every time. All right, very painful, because it's already inflamed, and then every minute you're going to squeeze out something. A very painful situation. Some people might have pain in the pelvic area, or that pain may spread to the entire abdomen, the entire belly. Some people might have a bit of diarrhea as well, because the irritation in the pelvis also irritates the rectum. Okay. And then, of course, fever. But some people may not have fever, but you may have fever, and then it may get to my patient that I described, where she's outright septic, having all these problems, including kidney failure and so on. So those are the classic symptoms of a urinary tract infection. In diabetics, because of nerve damage, the older diabetics get, the less likely sometimes you are to have these classic symptoms. So, okay, we diagnose urinary tract infection. And actually, I should mention too that for diagnosis, it's not just a culture, because a lot of people get into a cycle where they keep culturing their urine, right? But for us, especially me as an infectious disease specialist, we like to check or evaluate a culture result with another set of results. And specifically, we like to know, hey, there's germ, yeah, but maybe the germs are just hanging out because, the urine is sweet and the area is sweet and they just like the environment, but they haven't grown to the point of being invasive, of getting into the tissues and actually causing inflammation and infection. So we like to look at a urine sample under the microscope to see, are there a lot of pus cells? Because if you have a culture with bacteria, but there are no pus cells or less than 5 pus cells, then it means that you're not actually having an infection. You just have germs hanging out, but maybe they're waiting to have a party. And what you need to do is not give antibiotics, but make it a hostile environment for these germs that are hanging out and waiting for the right opportunity to rear their ugly heads and cause you to be terribly sick. All right, so not just a urine culture, but hopefully your doctor will also look at the urine under the microscope to assess for the amount of inflammation in your urine. Right, treatment obviously is going to be some type of antibiotic, right? Antibiotics to kill the bacteria. So depending on the culture, you will have an antibiotic selected. Now, if somebody's just having a urinary tract infection for the first time, they really have not had a lot of antibiotic exposure, the common antibiotics will probably work. But then the more you have a urinary tract infection, the more likely it is that the germs you have in your body are resistant to the common antibiotics. And so it's very important in those cases that you have a culture, because you want to target the specific germ properly first try, so that you don't have to worry now about an even more resistant germ that was untreated by the common antibiotics, and you will end up in the intensive care unit or even just hospitalized because of a bad infection. All right, so antibiotics, number one. Number two, yes, you can take antibiotics, but if your blood sugar is still high, if you're not tackling the root cause of this problem to begin with, then it's going to be harder to treat the infection, number one. And then number two, we might treat it and then you might end up with another one very soon after. So you must control your blood sugar as well to decrease the chance of getting more urinary tract infections in the future, and also to help cure this one once and for all. Right, you must hydrate yourself, because you want to make sure that your bladder is being flushed, so that you're washing out any remnant germs in the area and you're flushing out any remnant sugar in the area as well. Right, so hydration is key, and also to make sure your kidneys recover, right, or certainly stay working well, especially if you're going to be taking antibiotics, because some of the antibiotics might even damage the kidneys. So definitely want to make sure you're hydrated. And if you are taking any if you do have a yeast infection, then that's going to need to be treated as well. So it's usually pretty obvious with itching and irritation, or the doctor might be able to look and see signs of signs of a yeast infection in the genital area. That will also need to be treated, so that again we don't have entry points for bacteria. Okay, and then lastly, for somebody who might have nerve damage and you're not emptying your bladder completely, you're going to need to make a special effort to, after you first go to empty, then you have to try again to squeeze out the rest. And then some people, it's to the point where they actually need to help themselves manually empty the bladder by using catheters. Those are like straws that can be inserted into the bladder to let out all the urine, so you don't have this problem of stagnation, which is just a perfect environment for the germs. All right, so that's how usually people treat their urinary tract infection. Get a doctor to treat it for you. No-nos, and as somebody who I specialize in treating bad infections, right? So one of the big no-nos and pet peeves for infectious disease doctors, people who want to have a repeat urine culture after the urinary tract infection is treated. Now, if your infection, if you got your antibiotics and your symptoms disappeared, there is no need to repeat a culture, because sometimes, especially if your sugar is still a little high and you still have some sugar spilling into your urine, you're probably going to have germs lurking around in your urine. So you're going to have a positive culture. If you have stones that for whatever reason can't be removed, you're probably going to have a positive culture. But do you still have an infection? Probably not, because by then the amount of pus cells in your urine would have come down to close to normal. So testing yourself for a urinary tract infection when you have no symptoms and when you definitely got treated already means that you're setting yourself up to have multiple courses of antibiotics. And this is something that we see where people, if I remember, I had an actual friend, like she had reached out to me desperate, because she's like, Amina, I keep testing my urine and I can't get rid of this UTI, and I keep getting all these antibiotics and I'm starting to feel sick and I'm getting diarrhea. And I said, well, okay, are you having any symptoms? Is there any burning? Are you going more frequently? She's like, no, I feel fine. I just feel sick from all these antibiotics. I said, stop it. No more antibiotics. Do not test your urine again. There is no need to do a test when you have no symptoms, because what are you going to do with a positive result with no symptoms? You shouldn't do anything. So do not test unless you still have symptoms, right? So one of the big pet peeves. And then if maybe you happen to have had a culture for whatever reason, somebody did a culture, but then hopefully they looked at it under the microscope, and if there are no pus cells, then usually you don't have to work, particularly if you don't have symptoms. Now, if somebody has fever and other problems, then we make a decision depending on that. But just don't get into the habit of stressing yourself out based on a result on the paper when your body has symptoms that have gone away, right? Generally speaking, though, to end, I will tell you that prevention is better than cure. Now, of course, sometimes for whatever reason, maybe you've had some sort of surgery or you have stones or whatever, it's a little hard to prevent, but for the most part, by keeping blood sugar under control, you can greatly decrease the chance of having recurring urinary tract infections. Definitely see your doctor when in doubt. Sometimes you need a proper examination to see what might be going on, maybe physically, or especially if you've had surgery. If it's a man, maybe the prostate is big and they need to have that treated in some way. So definitely you have to always look for an underlying problem, especially with a recurrent problem like a urinary tract infection. But oftentimes in a diabetic, it's because the sugar is a bit on the high side and it's staying high. I hope you all found this video informative. I've been wanting to do this for a while, and I think I'm going to do a series on infections in diabetics, since after all, that is my specialty. Thank you for watching. Share this with somebody who struggles with a urinary tract infection, who has complained to you before, and I will see you on the next video. Bye.